Hi, it's a real pleasure to be able to speak to you again today about some updates on our GDNF gene therapy study for MSA. I'm Amber Van Laar. I'm the VP of Clinical Development for our CNS gene therapy studies here at AskBio, and I'm really looking forward to sharing some of these updates with you today. Here are some of my disclosures. In case it wasn't obvious, I'm an employee of AskBio, but I don't have any financial conflicts to disclose, and I'm not here to try and promote any service or product. If you have any questions about these disclosures or any information included here, please feel free to ask me questions later. But I'd like to discuss some of the topics for our discussion today. So the first thing I want to do is really talk about what gene therapy isn't. Really, this helps us to set the stage to better understand what gene therapy is. And then I want to delve into how we do gene therapy for the brain. This can be quite tricky, and so I want to be able to describe that to you a bit more. And then why are we doing gene therapy for MSA specifically? Then I want to wrap up our discussion with a brief overview on how to participate in clinical trials, and then just to briefly mention who we are as AskBio. So I think it helps to dispel some myths about what gene therapy is by first describing what gene therapy is not. And so the first thing you see here is we are not talking about gene editing. So this isn't CRISPR. We're not changing your own DNA. We're not making any edits. So that's not what gene therapy is and not part of our topic today. This also means we're not talking about cloning. So you cannot clone Dolly the sheep with gene therapy. This is also not how you make designer babies. As interesting as that would be, this is not how you do that either. And we're also not talking about stem cells. This is an important therapy and has a lot of overlap with gene therapy, but is a totally different type of approach for treating different diseases. And I think it's just important to make sure that, put these things out of your mind because we're not talking about these types of approaches today. And so if this is not what we're talking about today, if this is not gene therapy, what exactly is gene therapy? So I think it helps to start with some of the basics, and we're going to start with what are genes. And so genes are pieces of DNA that carry all the genetic information that make us who we are. So everybody has two copies of gene, one from mom, one from dad. The Human Genome Project, which wrapped up just a few years ago, estimates that all humans have somewhere between 20,000 to 25,000 genes. And what's interesting is it's only about 1% of those genes being different that makes us all have the variety of all the people that we see in our world today. And so just in case, make it really clear, our bodies are made up of a whole bunch of cells, and each cell has a bunch of chromosomes. And it's these chromosomes that are made up of our DNA. And in our DNA are a whole bunch of genes. And it's this material, these genes that give us all the unique features. So your eye color or your hair color, why you look like mom or dad. And it's from these genes that the cells use this information like a blueprint or instruction manual to then make protein. And the proteins then act like the business end of a gene so that we can be able to see the eye color, for example. So keeping in mind of how genes work, and go back to the classroom for a little bit more and work on some gene therapy 101. So as I just previously mentioned, genes act as the instruction manual for all of our cells. So this is important for just the growth and health of all of our cells. So again, our genes are DNA, and this is like the blueprint or instruction manual for every cell in our body. Our cells read these genes or the instructions, and from this they make new proteins. This is a normal function in all of our cells. And these proteins then work to signal the health of the cell, also signal if there's a problem within the cell, but are really critical for maintaining the function just to keep the cell alive and healthy. Gene therapy takes advantage of this normal function within the cell to make a protein. And in this case, we use a gene of interest, one that we want to use to help treat a disease, and ask the cells to read that instruction list to make a protein of interest. And that protein then acts like the medicine. So we're asking our own cells to then make and produce this new type of medication. And so with gene therapy, we take a healthy, normal copy of the DNA or the gene and using that as a way of treating diseases. And in that way, we're able to treat a whole host of diseases, not just ones that are kind of classically associated with genetic mutations. And MSA is a really good example of one of these conditions. And so we take this healthy gene and package it up for delivery by using an empty AAV, so this shape here. And the AAV has been emptied out, it's shelled out, and it is really good at entering and helping to deliver genes to brain cells. And so in this way, it helps to think of AAV like an envelope for it to deliver our message or a letter to the cells. AAV has been modified over time by researchers, and because of that, cannot make humans sick. And so it's been a really ideal sort of packaging material to use for gene therapy by AskBio, but also many other programs as well. So why AAV specifically, and why for the brain? So it turns out that most AAV2, which is a type of AAV, has been most commonly used for gene therapy when applied to the brain. And in fact, well over 200 people with a variety of brain diseases have been treated with AAV for a gene therapy approach. So this is well beyond MSA, but Parkinson's, but other conditions like brain tumors as well. And we like AAV for the brain because it's really good at getting genes into brain cells. And this is actually quite difficult and is a limitation of many other packaging materials that have been used for a variety of other types of diseases that have been used for gene therapy. It's also been safe. As I mentioned just earlier, many patients have been treated with the AAV in the brain directly. And this is considered also safe because the way that it's been manufactured, it cannot actually cause infection in humans. And more importantly, the effect from the gene therapy here is really durable, meaning that the potential benefit here is really long lasting when applied to the brain itself. So to kind of drive this message home one more way, we're looking at our DNA or our gene. This is the purple ladder here. And we need to put our gene into a packaging material. So this is the AAV you see here. And so I think it helps to think of our gene like a letter. So this is our message. And we need to package it in an envelope in order to deliver it to the place that we want it to go. So once we package the letter into our envelope, we then need to make sure it gets delivered to the right place. And in our case, we're using surgery, like a mail truck, to get it to the right part of the body. And for our case, we're looking to get this right to the right spot in the brain. And it's then the brain cells themselves that then receive this message and then read the instructions to then make proteins. In our case, this is something called GDNF, which I'll mention here in a minute. So another way to look at this is, again, here's our DNA, and we need our packaging material. In our case, we're using AAV. We're able to put this gene, this healthy copy of our gene, into the vector. And then once we are able to do surgery, we're able to put that gene therapy right next to the cells in the brain where we want it to go. And then the AAV is able to deliver our gene. And just like with an envelope, it goes away. And all we're left with inside the brain cell is just our gene of interest. And then the cell knows what to do with DNA, does it all day long. So it reads the DNA. And in this case, it's a healthy copy of a gene called GDNF, which I'll talk about again here in a minute. But it makes extra amounts of GDNF, and this is then secreted to all their nearby surrounding cells so they can see the benefit from extra GDNF as well. And I'll show you why that might be helpful for MSA. So to explain a little bit more about AskBio's program for GDNF gene therapy for multiple system atrophy. So why gene therapy for MSA? Well, I probably don't need to tell anyone in the audience here today that there really are very few treatment options available for patients living with MSA. And gene therapy is not just for genetic diseases. As I alluded to earlier, it really depends on what gene it is that you're trying to use. And so with what we're trying to do in this particular gene therapy program is to really work to address the root cause of MSA and not just treating the symptoms. Another major benefit of something like gene therapy for MSA is that this is a one-time treatment, so it does not require repeated administration of gene therapy. So let me dive into GDNF a little bit. So the full name here is glial cell line derived neurotrophic factor. This just tells you what cells are making it and that it's a growth factor for the brain. So GDNF is really important for just the normal health and functioning of dopamine cells. So these are the same cells that are affected in Parkinson's, but in several other diseases, MSA included. So it turns out that these levels of GDNF are actually quite high when we're young, and this tends to lessen over time as we get older. But even as adults, we still need a little bit of GDNF really to maintain the health and function of these dopamine cells. So what's the link between GDNF and MSA? Like why do we think about this? So it turns out that there is a loss of GDNF in an MSA, and it looks like this, for some groups, this looks to be a potential reason why MSA continues to progress over time. It's just not having GDNF around, not having that growth factor there. GDNF gene therapy may work by actually helping to the cells that are still there that are healthy enough to make extra GDNF to then help make and support the GDNF to support the cells that are nearby. The idea with GDNF gene therapy is that with more GDNF that's available, this may actually help to restore the health of the cells that are sick or near death. And that thereby allows us to potentially change and alter the course of MSA, while also potentially improving symptoms. So it turns out that when we look at a variety of models, there seems to be a pretty significant deficiency of GDNF in MSA. So when looking at animal models of MSA, there's actually a pretty significant loss of GDNF. And in fact, when you give back GDNF or restore the levels of GDNF, and this can be done in a variety of ways, that you actually can see improvements in motor and other behavioral function in these animal models of MSA. Interestingly, when we now have had a chance to look at MSA patient tissue, so in patients who have passed away, when we look at their brain tissue and measure GDNF there, turns out that there's 76% less GDNF in patient brains that have MSA as compared to controls or patients that did not have MSA but are of the same age. And interestingly, this is also related to over 90% loss of dopamine. This really explains a lot of why we're seeing some of the symptoms because there's so low dopamine there, but also gives some hints that there is a significant role of GDNF in the progression of MSA. So that's well and good, but how do we do gene therapy, especially in the brain? How does this happen? There's been a huge technological leap being able to allow us to do this really safely and reproducibly. And that's basically turning an MRI suite into an operating room. This allows us to do MRI monitored delivery of our gene therapy, so we can see exactly where our gene therapy is going. And this has really been a major advantage for all drug delivery to the brain. In this particular study for delivery of AAV2 GDNF, once patients have undergone a really rigorous screening process and patients have been determined to qualify for the study, they're invited to participate in the AAV2 GDNF study. This is a one-time MRI monitored procedure. This is administered in the MRI machine. And this is, again, a real technological leap to get us to this place. And we've been able to take advantage of a lot of learnings with this technique being used for over 15 years, again, for a variety of brain diseases, so not just MSA or Parkinson's, but other pediatric conditions and things like brain tumors as well. So what does this look like? How do we do the MRI monitoring of these infusions? So we're taking just one hollow tube that's carefully and slowly inserted to the back of the head on each side of the brain. And this allows us to fill up the structure called the putamen. So it's this green area here. And this also is really important for customizing these infusions for each individual, but also from left to right side of the brain as well. So we're really keeping this tailored to a person's anatomy. This also allows us a one-time sleep procedure to make this a little bit faster for the participant. This allows, though, for a very slow MRI monitored infusion of the gene therapy, and really is important to help us keep in a very precise part of the brain. So you can see the outlined areas here are parts of the putamen, the part of the brain where we want the gene therapy to go. And the white is where the gene therapy product itself is. And so you can see we're trying very hard just to fill in the red circles and not get gene therapy at different parts of the brain that we don't want it to go to. This is, again, a technique that's been used in a variety of different studies, and you can see some of them listed here. This is the current technique that we're using for this MSA study. This has been used quite a bit for Parkinson's disease and where we've had a lot of learnings. However, this is what we're planning on using for this GDNF gene therapy study for MSA. So as I mentioned before, we're taking these hollow tubes or a cannula, and that's what you see this black line is here. And I want you to follow where this white starts to develop in the structure. So we're looking to fill up this kind of darker gray blob here. This is the putamen, and we want to fill this up with the white. So what you can see here is on this one side, we can see the gene therapy product filling up our putamen. You can see it also coming here on the other side. And again, the goal here is really just to fill up this one structure of the putamen without filling in other parts of the brain here. By doing this technique from the back of the head and in this really kind of slow way, believe it or not, this actually has shortened the amount of the infusion time, the overall surgical time. But more importantly, this has been really helpful in making sure that we cover over half of the putamen or half of the structure. We really think that this is important to get the dose right. This is part of our dose optimization and actually may have some significant benefits for overall outcomes and how patients do after gene therapy surgery. So what does a typical surgical period look like? So there's a lot of visits that happen before we have gene therapy surgery itself. And just make sure that everyone that undergoes the surgery is safe and able to handle it well. But the surgery day itself is just a day. The nice thing is that there's nothing left behind except for the gene therapy product itself. So there's no hardware and no staging like we need to do for other types of procedures. Typically, most participants go home the next day, but for some people, they need another extra day in the hospital to recover. Again, after several visits to get to the day of surgery, there's still a lot of close follow-up even in the first few months after surgery, again, just to make sure everything is working all right. And in the first year, we have visits every 3 months with then annual visits up to 3 years, and just really close monitoring of all of our participants in this study. And just to cover a little more information on our clinical trial that we just started, we're looking for participants who have been diagnosed with MSA, but we're also looking for MSA participants that have clear Parkinson's type of symptoms. So this is like the stiffness and slowness that you would see in Parkinson's disease. We're looking for participants that are between 35 to 75 years old and less than 4 years from diagnosis without significant depression or memory issues. So again, really looking for an early stage patient with MSA that can, with the thinking that with the neurotrophic factor that we're using like GDNF, that this is best placed for patients who are very early on in their disease course. So they may benefit a bit more from something like GDNF. And so this means we're looking for participants who are not dependent on a wheelchair and able to commit to the long and intensive visits that we have over multiple years as part of the study. And more importantly, looking for participants who are able to qualify for a neurosurgical procedure like we just showed you the video of. So if a participant is determined to be eligible for this study, this would involve a one-time surgical delivery of our gene therapy to the part of the brain called the putamen. We are not expecting any changes to current medications. This is not required as part of the study. So if you're on something like levodopa, you would stay on that throughout the study. And so let your neurologist manage those medications if changes need to be made. This would mean a commitment to several visits over the course of 3 years. And this would potentially mean traveling to participating sites, which I know can be a struggle for some patients living with MSA. But overall, this does mean really close neurologic monitoring of all of our participants that are involved in this study. So I'm really pleased to announce that we have recently opened and activated a couple of our sites. So the University of California, Irvine is one of our main neurologic sites. You can see the email address here. I'm sure we can get this information to you later if you're interested. And then the Ohio State University is going to be a key neurosurgical center for us. They have deep expertise in this particular technique for delivering gene therapy to the brain. And you can see their email address here. We have a few more sites that are in the process of being activated, so please stay tuned. The best way to do that is to follow the clinicaltrials.gov website. We'll be keeping things updated there, but feel free to email us at info.cns@askbio.com as well if you want any more information on this study. I want to take just a second to talk about another study that we are getting ready to go at the same time as our MSA study. So this is a pre-gene therapy natural history study that allows us to look at clinical and biomarker changes in MSA over time. So this is including both PD and Parkinson's disease and MSA. One of the key things here is that we really want to better understand how clinical exams and other assessments change over time, and how these are impacted by MSA in this early population that we're looking at over the course of 12 to 18 months. So we're looking at MSA specific clinical tests, so things that you may be familiar with some of the motor exams that you may do with your neurologist, but also quality of life questionnaires and other changes like with blood pressure. This would include an MRI of the brain, and also gives us a look at biomarkers, both from the blood and spinal fluid. Again, really important to see how these things change in this early disease population over the year. And this is really important for us to better understand. This is invaluable information on how MSA is progressing and having an effect on these markers, which we think are really critical to help us understand and inform future gene therapy studies. So this is why we're targeting an earlier MSA population that's actually very similar to what you just heard from the gene therapy study for MSA. So again, looking for patients that are less than 4 years from the time of diagnosis with primarily Parkinson's type of symptoms, that's the Parkinsonian subtype. This means we're looking for participants who are still able to walk independently and without significant memory impairment, again, with the idea that we really want to try and catch as early of a diagnosis of MSA as possible, so we can better understand how these assessments change over time with MSA. So these may not be clinical studies that you're interested in participating in. However, I would still encourage everyone to think about participating in a clinical study. So how would you go about doing that? So one really important resource here is clinicaltrials.gov. All legitimate clinical studies should be listed on clinicaltrials.gov. It is required by law. This is funded by the NIH, as you can see here. And so it's a really important resource that provides information, not only of clinical studies happening here in the United States, but also some studies from around the world are included here as well. So this is a really important resource for anybody looking to potentially join a clinical study. So when you go on this website, this is one of the first screens that pops up, and you would just list under condition or disease. You want to look for studies that are in multiple system atrophy, and then you can say in other terms whether or not you want to look at gene therapy or what other investigation you might be interested in. So this is one option to better understand clinical studies for MSA. For those that may not realize this, the Michael J. Fox Foundation, though are really well known for Parkinson's disease research, they have separate resources for multiple system atrophy because there's just so much overlap between these two diseases. And so they have a really great resource called the Fox Trial Finder. They have a separate trial finder for MSA that's part of this, which has been very helpful. And it's a little more user-friendly than the clinicaltrials.gov. And then one other nice feature is they have a map of the United States. So it's really easy to find potential clinical trial sites that might be near you. So please consider taking a look at that. Let me just briefly review who we are with AskBio. So you may not have heard of AskBio specifically, but this company's been around for over 20 years. This was founded in part by Jude Samulski. He was the gentleman who discovered AAV, so the packaging material that we're using in this study. This may not have heard about AskBio though, because this is just the beginning to really develop expertise in CNS disorders or brain disorders like MSA. But the company has grown quite a bit. We're now over 500 employees with offices across the country. Those of us with CNS, the brain diseases, are here in Columbus, Ohio. But we also have several sites in Europe that you can see listed here. And because there's been such a decades of experience here working with AAV, this technology has really helped be the foundation for other AAV gene therapies that have actually been gone on to be commercialized by companies such as Pfizer, Takeda, and Novartis. So really building off of a really strong foundation in history here. We also really consider the patient voice to be really important as part of AskBio. So we have a very strong patient advocacy and engagement group. As you can see here, it's called Ask First. There's collaborative programs to bring advocacy groups, patients, and families together, really allowing the patient voice to guide every stage of development for these different drugs, and really helps us with regulatory groups like the FDA and helping to develop public policy. So we really welcome all voices. And if you have any interest in getting involved with Ask First, we'd be happy to have you as well. And with that, please, if you have any interest or want any more information, I would strongly encourage you to talk to your neurologist, let them know that you may be thinking of doing something like this gene therapy study. Please keep up to date with the clinicaltrials.gov, an eye out for the Fox Trial Finder. But feel free to email us at askfirst@askbio.com, info@cns@askbio.com, and we'll be happy to answer your questions that way. So lastly, again, these may not be the studies for you, but I would still strongly encourage everyone here to consider joining the fight and think about participating in a clinical study. And with that said, a big special thanks to everyone who's already participated in a clinical study. We couldn't do this without you. Thank you so much. I look forward to your questions.